Hi, my name is Greg Felt. I'm Director of Public Health in Sheffield. This is a COVID-19 situation report dated the 12th of January 2021. In short, it's bad in most places. Rates in the community are beginning to stabilise a little bit in southeast England, but there's still growth in some parts of the country. The fastest growth is in areas that were previously in Tier 2. And I think Tier 4, those areas that were in Tier 4, have slowed growth down a little bit. But the restrictions work. They do the job that was intended. It's difficult to work out exactly what all the data shows. There are some data issues over the Christmas and New Year period which haven't yet fully worked through. Testing behaviour was very quirky over the Christmas and New Year period. So next week we'll have a much clearer position on what's going on epidemiologically nationally. South Yorkshire and then Sheffield, rates are high, but comparative to much of the rest of the country, low. But they are high, they're far too high for comfort, and they are still rising but beginning to plateau. Very tentative about that, and I wouldn't want to call that too soon. So rates are currently approaching about 300 per 100,000 in a 7-day period. I'll remind you where we were in the run-up to Christmas. We were on about 125 cases per 100,000 population in the 7-day period. So rates, have definitively gone up over that period, and quite markedly so. So whilst they are low comparative nationally, they're still much too high. They're much too high for comfort. There's been an increase since Christmas in whole population and in the over 60s. That increase has mainly been driven by increases in the working age population, who are the most mobile population, obviously, most likely to mix with other people. That's where the virus has opportunities to spread and accelerate. The obvious danger is that then goes up the age bands into older people. There's a beginnings of a plateau. It's showing some signs of improvement. The rate is showing some signs of improvement over the last couple of days, but I'd really urge caution, and I think we are not in a position to change any of the restrictions anytime in the near future, regrettably. We're not yet seeing the effect of the lockdown. I think the data on that will become clearer over the next week or so. But I think we will be in a position of having restrictions in place for the foreseeable future if we're going to get our rates back down to the 100 per 100,000 or so range. As we get into spring, it's possible that rates will come down much more, but I think we'll be in a quite difficult place for the next period to come. In summary, we're seeing a rise that was expected. It will probably start to come down over the next period as the lockdown restrictions come into place. R naught is certainly above 1. We're well above 250 cases per 100,000 population. That is still rising but beginning to flatten off. Positivity is nearly 10%, and just before Christmas it was 6.5%. And hospitals are still very, very busy. Hospitals in Sheffield and South Yorkshire are not in the position that hospitals in lots of the rest of the country are, but it's a national health service, and the hospitals will be taking up some of the slack, taking some patients from other parts of the country. So we have zero room for manoeuvre, and we need to take care for some considerable time to come. It's not yet certain whether or not the restrictions, the lockdown is significant and restrictive enough to hold in check the new variant.